Most people assume a heart attack comes with a warning, a tight chest, a shooting pain down the arm, something dramatic enough to wake you up and call for help. But here's what I've seen over and over again in my patients. The most dangerous cardiac events after 60 happen quietly, while you sleep, with zero warning. And what truly stops people cold when I tell them this? Those events are almost always set in motion by something they did before turning off the light. Something completely ordinary. Something they never once connected to their heart. I'm going to show you 5 of those habits tonight, and exactly how to stop them before they stop you. Here's something most people your age were never told. Your heart doesn't clock out when you fall asleep. It shifts. In a healthy body, nighttime brings what I call the pressure drop. Blood pressure naturally falls 10 to 20%. Your heart rate slows. Your arteries relax. It's your body's built-in overnight maintenance system. But after 60, that system gets less reliable. Blood vessels stiffen. Pressure regulation becomes less precise. The hormonal signals that used to protect your heart at night, they start to fade. The margin for error shrinks dramatically. Think of it this way. During the day, your cardiovascular system has backup plans. It can adapt, compensate, correct. At night, those backups are largely offline. Your body is running on a skeleton crew. And that's exactly why the hours between midnight and 6 in the morning carry the highest risk of heart attack and stroke for people over 60. Not the afternoon rush. Not the morning commute. The quiet hours, when your habits from earlier that evening are still playing out inside your body. So, let's start with the one that surprises my patients the most. What time did you eat dinner last night? I ask every patient that. And for a lot of people over 60, the answer is somewhere around 8 or 9 at night. A full plate, pasta, rice, fried chicken, maybe a heavy dessert, followed by the couch, and then bed an hour or 2 later. I get it. Life gets busy. Families have schedules. Habits run deep. But from a cardiac standpoint, this is one of the most underestimated risks I see. Here's what's happening inside your body the moment you eat that late meal. Your digestive system demands a massive surge in blood flow. Your heart pumps harder. Blood pressure rises. The fats in your bloodstream, triglycerides, spike sharply in the 2 to 4 hours after eating. And now you're trying to sleep on top of all that. Your body expects the evening to be a gentle wind down. Instead, it's running a full cardiovascular emergency at the same time it's trying to shift into recovery mode. Those two demands are pulling in opposite directions. And in someone over 60 with any degree of arterial stiffness, that collision has real consequences. Research has consistently shown that eating within 2 to 3 hours of sleep raises nighttime blood pressure, increases acid reflux that can mimic cardiac symptoms, and elevates the risk of cardiovascular events during sleep. The fix is simple. Finish your main meal by 6 or 7 in the evening. If you need something later, keep it light, lean protein, vegetables. Not a heavy plate. Does that sound like your evenings? Most people say yes and had no idea it was affecting their heart. And that brings me to something even more critical. If you're over 60 and you take medication for high blood pressure, and statistically, more than 6 in 10 people your age do, I need you to pay close attention to what I'm about to say. Because this is where the most preventable damage happens. And most doctors simply don't take the time to explain it. Blood pressure follows a natural curve through the day. It rises in the morning, peaks in the afternoon, then dips at night. But a significant number of people over 60, especially those with hypertension, never get that nighttime dip. Their pressure either stays elevated or actually surges in the early morning hours. This is called nocturnal hypertension. Most people have never heard of it. And it is far more dangerous than daytime high blood pressure because the arterial walls are not braced for impact while you sleep. A pressure surge at 3 in the morning hits differently than one at 3 in the afternoon. It's more likely to rupture a vulnerable plaque inside a coronary artery, more likely to trigger dangerous clot formation, more likely to send someone into cardiac crisis before the sun even rises. If you take your blood pressure medication only in the morning, it may wear off by the time your body needs it most. If you've ever skipped a dose, you may have gone completely unprotected during the most vulnerable window of the night. Here's what I want you to do. The next time you see your doctor, Ask this one question: should I be taking my blood pressure medication in the evening instead of the morning? That conversation takes 2 minutes. There's strong clinical evidence showing that evening dosing significantly reduces cardiovascular risk overnight. That is not a minor adjustment. That is a potentially life-changing conversation. And most patients over 60 have never once had it. Don't assume the timing doesn't matter. In cardiology, timing can be everything. Now, I want you to think about the person sleeping next to you. Does your partner snore? Do you snore? That rumbling sound in the dark that everyone treats as an annoyance, something to joke about, something to poke your spouse over, I treat it as a cardiac warning sign until proven otherwise. After more than 2 decades working with heart patients, I mean that literally. Sleep apnea is one of the most underdiagnosed and dangerous conditions I encounter in patients over 60. It's estimated that more than 30% of older adults have some form of it, and the vast majority have absolutely no idea what it's doing to their heart every single night. Here's what actually happens during one of these episodes. You stop breathing. For 10 seconds, 30 seconds, sometimes longer. It may happen dozens of times every hour. Each time, the oxygen in your blood drops sharply. Your brain registers a crisis and fires off a stress response, adrenaline, cortisol, a sudden spike in heart rate and blood pressure. Your heart jolts awake while the rest of you is still asleep. Night after night, year after year. Imagine that happening 40, 50 times in a single night. The damage to your cardiovascular system is not subtle. Sleep apnea is directly linked to a 3 times higher risk of heart attack. It's strongly associated with atrial fibrillation, an irregular heart rhythm that itself dramatically raises stroke risk. And because the person is unconscious for all of it, they often don't know until something serious happens. The warning signs aren't always obvious. Yes, loud snoring is one, but also watch for waking up with headaches, feeling exhausted even after a full night's sleep, getting up frequently to urinate, or waking with a dry mouth or a sense of gasping. I had a patient, I'll call her Linda, 67 years old, no diagnosed heart problems, woke up exhausted every single morning. Her husband had mentioned the snoring for years. She laughed it off. After a sleep study, she was found to have severe sleep apnea, 52 episodes per hour. She started CPAP therapy. Within 3 months, her blood pressure dropped measurably without any medication change. She told me she hadn't realized how close to the edge she'd been sleeping every night. If you snore heavily, you're over 60, and you have any history of heart or stroke concerns, getting evaluated for sleep apnea is not optional. It is part of taking your heart seriously. But here's one more habit that almost no one connects to cardiac risk, and it sounds almost too simple. A lot of people over 60 deliberately stop drinking fluids after dinner. The reason makes complete sense. They don't want to wake up at 2 in the morning for a bathroom trip. Disrupted sleep is uncomfortable. Getting up at night increases fall risk. So they cut off liquids early, sometimes as early as 4 in the afternoon. I understand that completely. But here's what most people don't know. Going to bed, even mildly dehydrated, is a meaningful cardiovascular risk, and almost nobody is talking about it. When you're dehydrated, your blood becomes thicker, more viscous. It doesn't flow as freely through your vessels. For a young, healthy cardiovascular system, that's a minor inconvenience. For someone over 60 dealing with arterial stiffness and possible plaque buildup, it's a very different story. Thick blood moves slowly through already narrowed arteries. It's more prone to clotting. And here's the timing problem. During sleep, your heart rate naturally slows. Blood moves more slowly through your system anyway, and you've been lying still for 7 or 8 hours. Now combine that, thick blood, slow circulation, reduced movement, narrowed vessels, and you have a perfect setup for the kind of clot that causes strokes and heart attacks in the early morning hours. The fix? 1 full glass of water before bed. That's it. 8 ounces. Just enough to keep your blood flowing freely while you sleep. And keep a glass on the nightstand, because that dry, groggy thirst at 2 in the morning is your heart asking for something too. You don't have to choose between sleep quality and cardiovascular protection. You just need to know the connection exists. Now this one surprises almost every patient I bring it up with because it sounds almost too simple to matter. But I want you to think about it seriously. What temperature is your bedroom at night? Most people have never once thought about that in terms of heart health. But there is a specific range your cardiovascular system prefers, and outside of that range, your heart is quietly working harder than it needs to, all night long. When your room is too warm, above about 72 degrees Fahrenheit, your body works constantly to release heat. Blood vessels stay dilated. Heart rate remains elevated. Sweating increases fluid loss, which feeds right back into the dehydration problem. And your sleep quality drops. You spend less time in deep, restorative sleep, which is when your heart does its best overnight recovery. On the flip side, a genuinely cold bedroom, below about 62 or 63 degrees Fahrenheit, creates a different kind of stress. Cold causes your blood vessels to tighten to preserve core body heat. Blood pressure rises. The heart has to push against greater resistance. For someone with coronary artery disease or hypertension, that overnight pressure increase is not trivial. The sweet spot is between 65 and 72 degrees Fahrenheit. That range keeps your body in neutral territory, vessels relaxed, heart rate low and steady, sleep deep and uninterrupted. One thermostat setting. Real protection. Everything I've just described isn't a list of things to worry about. I want you to see it differently. When you put all 5 together, what you actually have is a simple, practical evening routine, one that fits into a normal life without any dramatic changes. Between 6 and 7 in the evening, that's your window for the main meal. Lean protein, vegetables, a moderate portion of carbs if you need them. A proper dinner at a reasonable hour, giving your heart 3 to 4 hours to settle before sleep. At 7, water and medications. And if your doctor hasn't specifically discussed the timing of your blood pressure medication with you, put that on your list for your next appointment. Evening dosing may be far more protective. Between 8 and 9, your wind-down window. A gentle walk, some reading, calm conversation. Step away from bright screens. The blue light suppresses melatonin and keeps your nervous system alert far longer than it should be before sleep. By 9, check your bedroom. Adjust the thermostat. Set a glass of water on your nightstand. 90 seconds. It matters. By 10, you're in bed. And one final detail that costs absolutely nothing. If you snore or have ever been told you stop breathing in your sleep, sleep on your side instead of your back. Back sleeping worsens airway obstruction significantly. A simple positional change can reduce apnea episodes while you work toward a formal evaluation. Dinner by 7. Water and pills at 7. Calm evening until 9. Room set by 9. In bed by 10 on your side. I want to be honest with you for a moment. Not as someone making a video, as a physician. I have sat with families in hospital waiting rooms at 5 in the morning. Families who had no idea anything was wrong when they said goodnight just a few hours earlier. I've reviewed case histories of people who were making plans, looking forward to grandchildren visiting, living their ordinary lives, and then didn't wake up. And in case after case, the contributing factors weren't mysterious. They weren't rare. They were a late heavy dinner, a skipped blood pressure pill, a bedroom that was too warm, a body quietly running low on water, an airway that had been collapsing silently for years while everyone assumed the snoring was just snoring. These are not exotic risks. They are the background noise of millions of ordinary American evenings. And when that background noise accumulates night after night, year after year, it can become a cardiac event that nobody saw coming, because nobody knew to look. The truth that years of patient care has taught me is this: most of the hearts I've had to help repair didn't fail because of bad luck. They failed because of missing information. Information the patients simply never had. You have it now. So let's bring this home. 5 habits, 5 fixes. Here's your action plan, starting tonight, not next week, not after your next checkup. 1. Finish your main meal by 6 or 7 in the evening. 2. Ask your doctor specifically about the timing of your blood pressure medication. Ask about evening dosing. 1 question. 2 minutes. Potentially life-changing. 3. If you snore, wake up exhausted, or anyone has ever told you that you stop breathing in your sleep, get evaluated for sleep apnea. This is part of your cardiac care now. 4. Drink a glass of water before bed. Keep one on the nightstand. Don't let your blood thicken overnight just to avoid a bathroom trip. 5. Set your bedroom between 65 and 72 degrees Fahrenheit. That one number protects your vessels and costs you nothing. Now I want to ask you something, and I genuinely love for you to answer in the comments. Which of these 5 habits do you recognize in yourself? I'd be willing to bet at least 2 or 3 of them felt familiar. You're not alone in that. Most of my patients see themselves in this list. The difference now is that you know what to do about it. If this was helpful, please share it. There is someone in your life, a spouse, a sibling, a close friend who is over 60 and has never once connected their evening habits to their heart health. Send it to them. It might be the most important thing they hear this year. And before I go, everything I've shared here is general medical information based on current cardiovascular research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medication schedule, please speak with your own physician. That's not a disclaimer. That's genuine advice from someone who wants you healthy and thriving for a long, long time. Take care of that heart. It has been working for you every minute of every night your entire life. Give it what it needs starting tonight.